November is National Prematurity Awareness Month, and it's a time to recognize the health risks of preterm birth, which is the leading cause of infant mortality. Baptist Health NICU Dr. Jonna Clark joins us to discuss this and ways to prevent it from happening. Dr. Clark, thank you so much for joining us today.
Thank you guys for having me. I really appreciate it.
Absolutely. Let's kind of define what exactly is preterm birth.
Right. So prematurity is a birth that's less than 37 weeks. So typically a pregnancy lasts between 38 to 40 weeks, but prematurity again is less than 37. So you can be either extremely premature, which is less than 28 weeks, all the way up to what we call late preterm births, which is usually between 34 and 36 weeks.
How many babies are born prematurely?
About 13.4 million per year. So that equates to about 1 in 10 births in the U.S.
Okay, so what are the health complications that can happen with a preterm birth?
Right. So there are a lot of health complications that can happen. It's mostly determined by how young, what the gestational age of the baby is at birth. But the most common are 3: breathing, temperature regulation, and feeding. So that's because a premature baby is born premature. So their lungs are premature, their digestive system is premature, and they're not born with all that good fat that a term baby might have. So breathing problems can be anywhere from a simple nasal cannula at birth to all the way up to needing a ventilator or a breathing tube for some time. The feeding complications are some of the toughest ones that we deal with. The IV is needed usually in the first couple of days of life until the baby can tolerate enough breast milk or formula to grow. And then what usually keeps the baby in the NICU until they're closer to term or their due date is learning how to feed. That suck, swallow, breathe is a skill, like learning a cartwheel. You know, you have to learn this skill. And also it takes a lot of stamina to take all your bottles before you go home. So that's kind of what usually keeps babies in until their due date. And then with the temperature regulation, babies usually need to be in an isolette or like an incubator until they're about 4 to 4.5 pounds.
Let's talk about some of those risk factors.
Absolutely, absolutely.
Risk factors that maybe women may experience when they're pregnant?
Right, exactly. So just like complications, there are many risk factors that can lead to this. And this is probably one of the most important things that we talk about because preventing risk factors and getting prenatal care is very helpful. So women that have had previous preterm births are at risk, also multiple, like twins or triplets, some infections such as urinary tract infections or STDs, some substances that moms might be using, tobacco, alcohol are legal ones, but they're big ones. Also illicit substances like cocaine, methamphetamines, and a big one is THC. It's sometimes appeared to be safe, but it's really not in pregnancy or in breastfeeding. Other risk factors are hypertension or high blood pressure, diabetes, and some things with the baby like genetic issues can cause issues as well.
As a NICU doctor, I'm sure you see so many parents with their babies, and of course, you probably have to try to comfort them the best as you can. It's a really scary situation. So talk to us about some of that great technology that's out there that's helping care for their babies.
Right, absolutely. So NICU is very unique in that it's one of the more recent medical professions, modern medical professions. It was kind of founded in the 1960s, and so since then we have a lot of things that we do now. So we have surfactant, so that helps our babies breathe, as well as other things like nitric oxide and many different ventilators than whenever we first started. And then we also have total body cooling that can help babies' brains that have had some scary birth events.
What does it mean to you whenever the families come back in with their babies, they're healthy, they're doing great, they're thriving? What does that mean to you?
Yeah, that's the best, obviously. So I've often said that my favorite thing about my job is that every baby is immediately, when they're born, they always have their own unique personality. And so watching that personality mature and grow over the time that we have the babies in the NICU, and then seeing that 2-year-old at the NICU reunion like run up to you is like, it's the best feeling. It's almost indescribable. It's just like pure joy.
You cry a lot? Because I think I'd just be like sobbing every day at work.
Yes. Well, sometimes, you know, a good go home and shower cries is the best thing for you. Sad movies really help.
Yeah, I understand that. Well, of course, we did go over some risk factors. Are there any other ways that moms can prevent this from happening?
Absolutely. Yes, absolutely. And so I think the most important thing that our moms can do is get into prenatal care. Get into prenatal care early and stick with those visits. I know it's hard, especially over the holidays. We're all very, very busy, but sticking with those visits. So if you have those risk factors, there are a lot of risk factors that are not in our control, right? And so they can help out with those. If you have high blood pressure, they can get you on high blood pressure medicine, and they can prevent a lot of prematurity. And sometimes you can't prevent that, but then they can create a best possible scenario around what's going on with the baby at the time.
Anything else that we should know about this awareness month?
Yeah, absolutely. Thank you for asking that. So I think the most important thing is just to get the facts, and so that's why we're talking today, is to give mom all the facts that they need to help protect themselves and to protect their babies. So get educated and seek prenatal care, for sure.
Dr. Clark, thank you so much.
Thank you so much. I really appreciate that.
Yeah, absolutely.